You're a primary care doctor talking to a patient called James Porter. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So, Mr. Porter, I've got some of your notes right here, but honestly, it'd be super helpful to just hear it from you. Like, how did all this start for you? What kind of treatments have you tried so far? And, just anything else that you think I should know.
Let me think. I guess it all started with some digestive trouble. I've been dealing with, bouts of abdominal pain and occasional bloating for a while. At first, I just thought, oh, maybe it's something I'm eating. But then it started turning into this more intense discomfort and cramping that would just come and go whenever.
How'd things go from there?
Yeah, it was rough. I was handling it as best I could. But the pain started messing with my sleep. I'd wake up in the middle of the night feeling nauseous. Then my appetite dropped, and I started losing weight without even trying. Eventually, I went to my GP, and they ran some tests. Turned out my calcium levels were high, so they sent me for more testing.
And what did they find?
That's when I was diagnosed with primary hyperparathyroidism. I was surprised it's not something I'd heard of before. The specialist explained it was due to an overactive parathyroid gland, causing calcium levels to be high. I didn't know much about it, so it was a lot to take in.
And how have you been managing it since then?
Well, they suggested monitoring my calcium levels closely and recommended parathyroid surgery as the most effective treatment. I had the surgery a few years ago, and it went well. The symptoms improved, and I was back to feeling normal for a while.
Did you have any family history of this?
No, not that I'm aware of. My family history is mostly clear of major health issues, so it was unexpected. They explained it's not always genetic, but it could increase the risk.
And what treatment was recommended at that point?
They suggested monitoring my calcium levels closely and eventually recommended parathyroid surgery. The surgery did help. For a while, I was back to a sense of normalcy. My energy returned, and I could get on with things again.
That's good to hear. So what brings you in today?
Well, since the surgery, I've started having new symptoms that I didn't expect. I've noticed some joint pain, mainly in my hands and wrists. It's not constant, but it's there often enough to be annoying. And I get this persistent fatigue. Even after I've rested, I still feel drained.
Fatigue that doesn't go away with rest is definitely worth looking into. Anything else?
Yes, I've also started experiencing these small muscle spasms. They're minor, but they catch me off guard because they happen unexpectedly, often when I'm completely relaxed or not engaging in any strenuous activity. So it's not just a twitch, it feels like my muscles are reacting on their own, even if I'm just sitting still. While they aren't painful, the spasms are noticeable and a bit unsettling.
I see. It sounds like your symptoms are manageable, but I can understand why they're concerning. To get a clearer picture, I'd like to start by reviewing any current medications you're taking. This will help us rule out any potential side effects or interactions that could be contributing to these symptoms. By examining everything you're currently prescribed, we can see if any adjustments are necessary or if further investigation is needed.
Sure, that makes sense. It could definitely be a contributing factor. I've been trying to keep everything as stable as possible, sticking to my usual routines and managing stress where I can. But despite my efforts, I've noticed that these new symptoms have been increasingly persistent. The joint pain, particularly in my hands and wrists, is there more days than not, and it really affects my daily activities. And then there's this deep, unshakable exhaustion. It's not just regular tiredness, but a kind of fatigue that seems to linger even after I rest. It's becoming harder to ignore.
Well, we'll get to the bottom of it together. I'll start by carefully reviewing your medications to see if there's anything there that could be contributing to these symptoms. If necessary, we can also look into some additional tests to gather more information, whether it's lab work, imaging, or specific screenings to rule out underlying issues. Let's take this step by step and see if we can pinpoint exactly what's going on so we can find the best approach to help you feel better.
Thank you, doctor. I really appreciate it. It would be such a relief to finally get some clear answers and understand what's causing these symptoms. I've been dealing with the uncertainty for a while now, and it's starting to weigh on me. Just knowing there's a plan in place to investigate this thoroughly and hopefully get to the root of it gives me some hope.
Good morning, Mrs. Benson. I understand that you've been dealing with some health challenges for a while now. If you're comfortable, could you walk me through how this all began? I'm interested in hearing about any initial symptoms you experienced when you first noticed them and any significant changes over time. This will help me get a clearer picture of what you've been through and how best to support you moving forward.
Good morning, Doctor. It's certainly been a long and challenging journey. It all started with this persistent fatigue and a mild, low-grade fever that lingered much longer than I expected. At first, I didn't think too much of it. I assumed it was just a passing thing. But soon, I noticed my energy levels dropping drastically. I began feeling completely drained, even after a full night's sleep. My appetite also began to fade. Foods I used to enjoy no longer seemed appealing, and eating became a bit of a chore. These symptoms kept getting worse, and that's when I started to worry.
I understand, Mrs. Benson, along with the fatigue and appetite loss, did you happen to notice any other physical changes? For example, any changes in your weight, skin, or muscle strength? Sometimes subtle physical can provide important clues. So if there's anything you remember, even if it seemed minor at the time, it would be helpful to know.
Yes, unfortunately, I ended up losing a significant amount of weight within just a few weeks. As I wasn't trying to lose weight, and the pounds just seemed to slip away. My clothes started to feel looser, and I began noticing how quickly I was becoming thinner. That was alarming, especially since I was already feeling weak and fatigued. It was the suddenness and speed of the weight loss that really concerned me and made me realize I needed to seek medical help. That's what ultimately prompted me to come in for tests.
I see. And did the blood tests help shed any light on what might be causing these symptoms? Sometimes they can reveal underlying issues that might not be obvious otherwise. I'd be interested to hear what the initial results showed and whether they offered any insight into why you've been experiencing these changes.
Wes, the blood tests did provide some answers. It turned out that I have lupus. Hearing there was a real shock, it's not something I ever expected to be dealing with. I had never imagined that my symptoms could be tied to an autoimmune condition. At first, the diagnosis was overwhelming, but at the same time, it gave me a sense of relief to finally understand why I'd been feeling so unwell. I could finally connect the dots, and knowing the cause helped me make sense of everything I'd been experiencing.
Right, lupus can certainly be challenging to manage, and I know it often requires a multifaceted approach to keep symptoms under control. I'm curious to hear what your doctor recommended for treatment. Did they discuss any specific medications, lifestyle adjustments, or perhaps a plan to monitor any flare-ups? Managing lupus can sometimes involve making adjustments, so I'd love to hear what steps were initially recommended to help you manage the symptoms and improve your quality of life.
I was advised to have regular checkups to monitor my condition closely, which makes sense given the unpredictable nature of lupus. Along with that, my doctor prescribed a corticosteroid to help manage the symptoms. It has made a noticeable difference in how I feel, alleviating some of the fatigue and discomfort I was experiencing. However, I can't help but worry a bit because autoimmune conditions run in my family. My aunt has rheumatoid arthritis, and I've seen how challenging that can be. Knowing that there's a genetic component to these issues makes me anxious about my own health and what the future may hold.
And that sounds like a lot to cope with, especially given your family history and the challenges that come with managing a condition like lupus. How have you been feeling since starting the corticosteroid? Have you noticed any improvements in your energy levels, pain, or other symptoms? Sometimes these medications can take a bit of adjustment, and everyone responds differently. I'd love to hear about any changes you've experienced, whether positive or challenging, since starting the treatment, as it might help us understand what's working well and where we might need to make adjustments.
Initially, the medication made a noticeable difference. It was incredibly effective at helping me regain my energy, which was such a relief after feeling so fatigued for so long. I found myself able to return to my regular daily activities without that constant sense of exhaustion weighing me down. Simple things like going for a walk, doing household chores, or even socializing felt manageable again. It was a huge boost for both my physical health and my mental well-being to feel like I was starting to get my life back on track.
But you've started noticing new symptoms.
Yes, unfortunately, the improvement didn't last as I had hoped. Recently, I've started to experience pain in my knees and hips, which has made it harder to stay as active as I'd like. The discomfort can be quite intense at times, especially when I try to walk or stand for long periods. On top of that, the fatigue has crept back in as well. No matter how much I rest or sleep, I never feel fully refreshed. It's like there's a constant low-level exhaustion that I just can't shake. These symptoms have been discouraging, especially after initially feeling so much better.
No, I understand. And how is this affecting you day to day?
Well, I've started noticing some occasional brain fog, which has been a new and somewhat unsettling experience for me. It's subtle, but I can feel it affecting my concentration and mental clarity, especially in the afternoons. I find myself struggling to focus on tasks that would normally be routine, like reading, working on projects, or even holding a conversation without losing my train of thought. It's as though my mind just becomes hazy or sluggish at times, and I have to work much harder to stay on track. While it hasn't completely stopped me from getting things done, it definitely slows me down, and it's frustrating. I feel like I'm not as sharp as I used to be, and that's a bit concerning.
That sounds challenging. I think it would be a good idea to review your medications. We may need to adjust your dosage to better control these symptoms.
That sounds sensible. I just don't want my energy levels to keep dropping like this. It's making things hard. Just as a reminder, my symptoms include ongoing joint pain and dropping energy levels. The joint pain affects various areas, particularly in my knees, hips, and sometimes my hands and shoulders. It can range from a sharp to an aching pain and tends to worsen with physical activity or at certain times of the day. This pain has really limited my ability to stay physically active, which has been quite frustrating. In addition to the joint pain, my energy levels have noticeably dropped. Even after a full night's sleep, I still wake up feeling drained, and simple daily tasks feel exhausting. This lack of energy makes it challenging to keep up with work, social activities, and even routine household chores, which has really affected my quality of life.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Mr. Johnson was admitted with an acute kidney injury, likely a result of both dehydration and poorly controlled diabetes. He's a 75-year-old gentleman with a medical history that includes hypertension and type 2 diabetes, both of which can contribute to renal strain. Since his admission, we've observed a slight improvement in his renal function, which is encouraging. However, we need to be very cautious with his fluid management to prevent any risk of fluid overload, as his kidneys are still recovering. To support his renal health, he's on a strict fluid restriction of 1.5 liters per day. Additionally, we've discontinued his NSAIDs, as these can further stress the kidneys, and we want to minimize any potential for additional kidney injury. He's also on a renal-friendly diet to help manage his electrolytes and reduce the kidney workload. It's crucial that we document his fluid intake and output meticulously, as this will guide ongoing adjustments to his care plan. His electrolytes are being closely monitored, so please be vigilant with any lab results. Finally, avoid administering any medications that could potentially compromise his kidney function further, as his condition remains delicate.
Mrs. Stevens, your recovery after the knee replacement surgery has been excellent so far. Your commitment to your rehabilitation is really paying off, and we're seeing great progress in your strength and mobility. Today, we're going to concentrate on some strengthening exercises designed specifically to support your knee and help restore full function. These exercises are essential to keep up with at home, as they'll help improve your flexibility, balance, and overall stability. Aim to do them twice a day, as consistency will be key to your progress. However, please remember that if you experience any sharp or unusual pain while exercising, stop immediately. It's normal to feel some discomfort, but sharp pain is a sign to pause. If this happens, let me know at your next appointment so we can make any necessary adjustments to your routine. Also, applying ice regularly, especially after exercise, will help manage any swelling or soreness you may feel as you increase activity. 20 minutes with ice after your exercise session should be beneficial. Keep up the great work. You're on a strong path to recovery.
As you're all aware, the patient in room 204 has been placed under isolation precautions due to a suspected case of tuberculosis, TB. TB is an airborne infection, which means it can spread through respiratory droplets, so it's crucial that we strictly follow all safety protocols to protect both the patient and staff. We're awaiting the sputum test results, which should be available later today. Until we have definitive confirmation, please continue to follow airborne precautions. This includes wearing an N95 respirator mask whenever entering the patient's room, as well as any other personal protective equipment, PEEP, recommended for airborne infections. Make sure that your mask is fitted properly, as this will offer the best protection. In addition to PEEP, please try to limit the number of staff members entering the room to only those who are essential for the patient's care. This will reduce the risk of exposure and help manage infection control. If possible, try to combine tasks to minimize the frequency of room entries. Remember to practice thorough hand hygiene both before and after any interaction with the patient or their environment, and ensure all equipment used in the room is either disposable or properly sanitized after each use. We'll update you as soon as the test results are available, but until then, let's prioritize safety and vigilance in adhering to these precautions.
Is Carter experienced a restless night primarily due to significant pain in her lower back. To address her discomfort, we adjusted her pain management plan and provided her with an additional dose of analgesic around 2 a.m. This intervention appeared to be effective, as she reported some relief following the administration, which allowed her to rest a bit better afterward. Throughout the night, her vital signs remained stable, which is reassuring. However, it's essential that we closely monitor her this morning. We need to evaluate her pain levels and determine if further adjustments to her pain management strategy are necessary to ensure her comfort and support her recovery. Additionally, she is scheduled for an MRI later today to further investigate the underlying cause of her back pain. The results of the MRI will be crucial in guiding any subsequent treatment decisions. Therefore, while we keep her comfortable, let's also ensure we're attentive to any changes in her condition this morning, particularly regarding her pain levels and overall response to the current management plan.
I'd like to schedule a follow-up appointment for 2 weeks from now to reassess your condition and monitor how well you're responding to the treatment we're starting today. This follow-up will give us an opportunity to evaluate whether your symptoms have improved, remained the same, or worsened, and allow us to make any necessary adjustments to your care plan. It's important that we check how the medication, such as the albuterol and any other recommendations I've made, is helping to manage your shortness of breath and persistent cough.
Mr. Jenkins, I understand that you've been experiencing some difficulty with your blood pressure medication. You mentioned feeling dizzy after taking it, particularly in the morning. I want to reassure you that dizziness is a known side effect of this type of medication, and we can definitely work on managing it. To address this issue, we can consider adjusting either the timing of your medication or the dosage. It's important that we find a regimen that effectively controls your blood pressure while minimizing any uncomfortable side effects. I'll be sure to discuss your current prescription with Dr. Patel to explore the best options for you. In the meantime, to help reduce the risk of dizziness, I recommend that you take extra care when getting out of bed. Try to sit up slowly and pause for a moment before standing to give your body time to adjust. If you find yourself feeling lightheaded, it's a good idea to stay seated or recline until the feeling passes. Let's work together to make sure you feel more comfortable while managing your blood pressure effectively. Please don't hesitate to reach out if you have any more concerns or if the dizziness continues.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Extract 1, questions 31 to 36. You hear a presentation by a specialist cancer nurse called Sandra Morton, who's talking about her work with prostate cancer patients, including a man called Harry. You now have 90 seconds to read questions 31 to 36.
My name's Sandra Morton, and I'm a specialist cancer nurse helping cancer patients deal with their diagnosis and treatment. I'd like to tell you about the type of work I do, and particularly about one of my patients recently diagnosed with prostate cancer. Let's call him Harry, to illustrate the sort of things I get involved with. Now, before we get on to Harry, I'll give you a bit of background. Clearly, my job covers many aspects of patient care. But what's the priority? Firstly, prostate cancer is in fact the most common cancer in men in the U.S., with almost 300,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating. Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective. So, let me tell you a bit more about my patient, Harry. Like many middle-aged men, Harry was offered a routine health check at his local doctor's office. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. But he'd promised his family he'd look after himself. His partner had died of skin cancer some years before, so he felt obliged to go. It was during his appointment that, based on a few symptoms he mentioned, Harry's doctor decided that he'd need further investigation for prostate cancer and referred him to a specialist clinic at the hospital. Harry's trip to the clinic started with a routine blood test, which initially showed a slightly low hemoglobin level. A further test then revealed that his PSA, the prostate-specific antigen, was high at 20. He then saw a urologist who conducted a digital rectal examination and biopsy, a procedure that I always try to explain to patients may be uncomfortable, but is entirely necessary. In fact, though, Harry said the 3-week interval between having a biopsy taken and hearing the outcome was far more of an ordeal. Harry told me that when he went to see the urologist to get his results, he immediately sensed he was in trouble. Although the urologist was very considerate in delivering the news, unfortunately the indications were that Harry did indeed have prostate cancer. He was assured that the cancer was low grade and not aggressive. Harry had suspected the worst, and though he'd tried to prepare himself for it by doing some online research, finally hearing that confirmation was still a shock. In fact, the very mention of the word sent Harry into panic, which was very unlike him. So at the time I first met him, he was very vulnerable and grateful to have someone to talk to. Of course, the response to the illness amongst prostate cancer patients like Harry can vary enormously. I've dealt with some men, for example, who haven't really realized the importance of keeping up their medication because they've felt relatively well, especially if they've been experiencing unwanted side effects. Unfortunately, though, any break gives the disease the perfect opportunity to spread into the bones, making it much more difficult to treat and a successful outcome less likely. And some treatments do cause some unfortunate effects, such as erectile dysfunction, which some men really feel uncomfortable discussing because it's a sensitive issue. Other patients have mentioned that even though they've been given a lot of help, it's still difficult to weigh up the pros and cons of the various treatment options they're offered, from ultrasound or radiotherapy right through to radical prostatectomy. So responses like these need to be taken into account by specialist nurses when talking to patients. For me, these factors really underline the importance of the community follow-up clinics we have in my area, which address many of these issues in the provision of health care for cancer patients. Staff at these clinics see patients during their recovery and only send them back to hospital for treatment if they develop significant new symptoms. Seeing patients in the clinics means staff get to know each patient and build a relationship with them, which enables nurses like me to dispense advice and answer questions. And although we have no firm evidence, staff feel that's far more beneficial to patients than attending a large hospital clinic. So we're hoping more clinics like these can become available.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a neurologist called Dr. Frank Madison giving a presentation about the overuse of painkillers. You now have 90 seconds to read questions 37 to 42.
I'm Dr. Frank Madison, and I'm a neurologist with a special interest in the overuse of painkillers, particularly of opioids, something experts are now calling the silent epidemic. Now, we've all seen the stereotypical images of addicts hooked on recreational drugs, but addiction to painkillers like opioids has a much less familiar public face. From what I've seen, one reason for this is that the range of people affected makes them less easy to pigeonhole. I mean, there's no typical age, social class, and so on. And of course, most people seeking help for opioid overuse were initially prescribed the medication by their own doctors for pain relief. This highlights a major part of the problem. Physicians often pay little attention to the possible risk of addiction. They need to look carefully at patients' personal histories and assess the risk, considering things like depression and anxiety disorders, before prescribing opioids. In recent years, there's been a dramatic increase in opioid prescriptions. I see a pattern not just of GPs overprescribing, but of GPs inappropriately prescribing. Sure, people want their pain relieved immediately, that's understandable, but proper pain management requires lengthy face-to-face input, which time pressures don't allow, so easier alternatives have become the default option. What's more, although opioids can provide effective relief in the short term, they shouldn't be the automatic first-line therapy. Many alternatives do exist, and they're no more costly. People generally think of pain as a direct symptom of a problem in the affected area. But pain is an extremely complex subject, and it's one that used to be underrepresented in medical education. Thankfully, that's no longer the case, and doctors now realize that when a patient complains of acute back pain, that pain may not be due to a clear and treatable disease, but that such pain often presents in people with other medical problems, and these need investigation. Although there are distinct types of physical pain, all too often, I see sufferers lumped together in one category, which means that unfortunately, not all treatments are going to work equally well. For example, we first need to know, is the pain caused by inflammation as opposed to nerve damage? Establishing this makes initial mistreatment far less likely, meaning that treatment is more effective and the risks of long-term problems are reduced. But it's not just opioids we need to watch. Patients often self-treat with readily available painkillers like paracetamol. And while such drugs play an essential role in pain management, people still need to know more about them. We've been pretty successful in publicizing the dangers of accidental overdose, and clear information's given about the effects of taking these drugs long-term, so public awareness about increased tolerance levels is also gradually improving. Many doctors also now actively warn patients about the spiral of taking higher and higher doses for pain relief. Worryingly, though, I've seen cases where people on drug regimes for other conditions inadvertently take painkillers which add a potentially hazardous ingredient to the mix already in their system. This is something which needs urgent attention. I'd like now to talk about an osteoarthritic patient who was referred to me, a 30-year-old woman, let's call her Anne, suffering from sarcoidosis, an autoimmune disease leading to chronic organ inflammation. She was prescribed various drugs, but though the disease was soon brought under control, the pain lingered, with Anne gradually becoming dependent on prescription opioids. Typically, she was terrified of stopping them, yet the more she took, the worse she felt. The thing is, her prescription would have been ideal for short-term pain, like that following surgery, but should never have been given for the chronic pain she was experiencing. And we all know that living with medication dependency has devastating consequences, not only on social well-being, but also on ability to function professionally, as was the case for Anne. She eventually went on long-term sick leave, as often happens in such cases. Thankfully, Anne's now much better. Having recognized her dependence, and with the necessary support, tools and techniques, she's now off painkillers. The crucial thing is to prevent dependence in the first place. Anne's GP prescribed opioids in good faith, aiming at pain reduction, but failed to set an end date for these. He hadn't anticipated the possibility of eventual drug reliance, this being new territory to him. Anne couldn't hide the visible results of the quantities she was eventually taking, so her GP questioned her about intake. She reluctantly admitted supplementing her prescription from sources like friends and family, something her GP had suspected but hadn't investigated. Anne now realizes that drugs weren't fixing her problem, and though withdrawal took several tough months, her determination to succeed has paid dividends.
That is the end of Part C.